Hello, everybody. My name is Jacob, and today we're going to be talking about the crisis support services in Ontario. With the coronavirus causing massive issues, these services are more important than ever, and understanding them is of greater imperative value than it ever has been before. I'm currently working with Mallory and Yancey, two great partners who did so much for this presentation. To start out, I would like to tell you that Canadians will experience various crises over their lifetimes, and as such, we need to be able to help them during their times of need. This is what crisis support services does. They rely on community involvement, federal support, and most of all, social support workers working synergistically to create something that any individual cannot achieve alone. This is known as the Ministry of Children and Community Social Services, or the MCCSS. A little bit of a mouthful, but what are you going to do? These agencies range from provincial free services, and I'm just going to list them off here, at least some of the ones we've found. This isn't comprehensive, but it is a good deal of them. You have the provincial free medical advice line, Connects Ontario 211, emergency shelters, sexual assault centers, Durham Rape Crisis Center, the Human Trafficking Hotline, mental health and addiction treatment services, hospital emergency and urgent care, in-person crisis services, and support for Indigenous women. I'm going to be going over a few of the more prominent services offered in Ontario, and this is not comprehensive, but I would like to give you an idea of what these kind of things do. First off, we have 211 Ontario. The MCSS website provides further outreach resources such as 211 Ontario. This is a helpline for those requiring emergency management, child and family support services, and emergency income support. 211 also has subtopics dedicated specifically to mental health and addiction support centers. Anyone can call 211 at any point. They are also available for email or chat online, and you may even call them from outside of Canada if you need help. 211's funding is largely subsidized through the MCCSS. The amount in 2019 was $4,160,077. They have a total of 131 active partnerships in various sectors. Important ones include 26 community involvement and 22 health partnerships, alongside housing and emergency management services. So very well connected. We also have Telehealth Ontario. It's a free 24-hour confidential service that connects you with a registered nurse. This service frequently deals with teen health issues, concerns related to mental health, and suicidal ideation, breastfeeding, dietary issues, cigarette addiction, refugee health, things like this. Unfortunately, telehealth is only offered through the telephone. However, they do have access to over 300 languages for all users and are overseen by the MCSS. So if you want to make contact, feel free to contact them for feedback, comment, or question. Connects Ontario is another specified helpline which provides services for people who are facing mental health challenges relating to gambling, alcohol, drugs, and depression. It is a free, confidential 24-hour service that also has chat requests if you need it. Connects Ontario is another great agency. It's known for being the most comprehensive mental health condition database in the province. It uses extensive statistical data and trajectory strategic planning to determine policy on Ontario social services. So this organization actually informs the government. It is the premier tool in helping individuals determine real-time availability for support groups and registry in group programs. Telehealth and Connect Ontario are partnered up in an effort to redirect people away from hospital emergency rooms. They offer first point contact via telehealth nurse, who may direct you to Connect Ontario navigation specialist. So there are people whose entire job is to connect you to the correct person to get you some help. The MCSS is responsible for funding these organizations as well as their formal and informal key stakeholders. So these are people in education, justice, and health who want to help. So we also have organizations such as the Durham Rape Crisis Center. Though the Durham Rape Crisis Center, we learned about programs in Ontario that service individuals who are victims of sexual harassment, assault, exploitation, and human trafficking. They offer confidential 24-hour support line for anybody who is experiencing violence, past or present. Family, partners, and friends are also encouraged to to give them a call if they have a loved one who needs support. The DRCC website is really dense with information that includes safe places to go, safety plans, and other resources. To elaborate a little bit, this includes information and support in creating immediate safety plans, and this also includes helping individuals execute recovery and escape plans from abusive loved ones. They work with child support services to report child victims of abuse and support anyone feeling suicidal or helpless. They provide group and individual counseling, such as advocacy and accompaniment, with a focus on public education for the community. Counseling services are free and confidential and include workshops for women 16 years of age or older who may have been victims of sexual violence. They emphasize the idea that you're not alone, and that that others are understanding of your trauma, and the objective is to build trust. They also try to encourage you to form connections and feel empowered through individual talk therapy with a trained professional. This is a sign-up service that runs during regular business hours as well as evening sessions. There is also a drop-in office for those who may not feel ready to sign in, but still want to talk about their experience. This is called the Survival Circle, with a maximum of 8 survivors who, at one time. They are always in attendance, and it is run once or twice a month during afternoon or evening hours. This is a charitable organization regulated under the Income Tax Act through the CRA. It falls within Ontario's MCSS ministry and is also affiliated with the Ministry of Women's Issues. Through the MCSS, this and other agencies focus on issues related to human trafficking. Agencies services such as Indigenous communities, crisis hotlines, legal support information on the justice system, prevention and education programs, and training for service providers, so people like us. Organizations such as the Canadian Health Trafficking Hotline is helpful for support services and is funded by Public Safety Canada. The Canadian Health Trafficking Hotline offers a 24-hour assistance for those who wish to report themselves or known victims of forced labor or prostitution. The response team will connect callers to support teams to take down information and, when necessary, forward to law enforcement. This is people of all ages, genders, backgrounds, foreign or national. They are partnered with the Anti-Human Trafficking Group and experts in Polaris in the U.S. For those who don't know, Polaris is perhaps the biggest anti-human trafficking group in North America. The CHTH places an emphasis on Polaris's eradication model. It focuses on responding actively and providing immediate resources to the public, as well as providing partners with data and knowledge for prevention and disruption of these rings. They also have widespread campaigns, often held to disrupt trafficking networks. As we researched the various platforms in crisis support in Ontario, we were generally impressed with the options available. Though there are many examples of people falling through the cracks, we must consider following we must consider the following barriers that individuals might face. So, number one, not everybody has access to the internet. Elderly, people with disabilities, people with limited income. Unfortunately, many of these crisis support services are based online or through the telephone, but if you don't have access, you may be unaware of the various resources. People have found themselves in a certain level of despair and may not have the strength to access the resources. Also, people who maybe call in or have issues while they are intoxicated may be able to maybe not be taken as seriously as someone who was not intoxicated. Staff members that work in companies that offer crisis support services, such as mental health benefits, may not be aware of the coverage they're offered, and therefore may not have the financial support of these companies. Companies such as Morel Chappelle charge their clients directly. They may be less inclined to make the benefits known to their employees. Number 4, people of low socioeconomic status may experience more financial stress due to lack of time and money. They may only have access to government-funded services, and this reduces the options available to them, as well as ignore the individualistic needs and their unique circumstances. Number 5, staff members responsible for the facilitation of these services may be volunteers and kind of underqualified. Some services do charge money and will employ people who have at least a master's degree. This will establish them as specialized, provincially and provincially regulated industries that ensure quality of service. So a little bit of a higher end there. Women are always a more vulnerable population and are often burdened with the requirement of a full-time job, work, care for kids, and a household, and just have less time or money for personal care. In direct relation to potential shortcomings, these platforms have funded articles and studies. These are conducted by 211 Toronto and used to evaluate how these platforms handle crises, such as the 2003 SARS outbreak. One constructive option is that Toronto is at 211 Toronto and other helplines to upgrade their data entry system. This could help mitigate the stress from unexpected events such as SARS or COVID. The nature of this type of work also brings a great deal of shame and stigmatization. The worry is that individuals may identify with their traumas and start isolating and hiding their internal struggle in order to keep up appearances and appear strong to their family and friends. Health insurance plans require greater coverage for mental health awareness efforts and need to continue to force breakdowns of barriers and create a more accepting society. OHIP does not cover psychotherapy, which is currently really expensive, so that's something we could work on. We could implement training to teach nurses to facilitate households in need for someone experiencing a crisis in the hospital. If this isn't handled with preventative care, the homeless people will continue to face challenges that result in them in the emergency department. So nurses could be trained to act proactively during the discharge phase to ensure positive results and breaking the cycle of events. These are just some of our suggestions, but otherwise, I'd like to thank you all for listening, and I hope you have a good day.